And today I'm joined with Dr. Karen Stern, who is the current Endourology Fellowship Program Director at the Mayo Clinic, College of Medicine and Science in Arizona. Thanks for coming here today and spending your time. What are your thoughts on the evolution of robotic surgery as it pertains to endourology?
Yeah, so that's a great question. As it pertains to stones, it's really been sort of a slow adoption. A lot of that is my personal feeling is robotics takes so long to develop that by the time it actually develops, it's kind of outpaced the other technology. So when you look at like robotic PCNL or something like that it's all developed to maybe make percutaneous access easier, but we already have ultrasound access, which has come up in the meantime. When you look at robotic ureteroscopy, there's probably a lot of benefit to it for surgeon ergonomics and such, but it was developed really with traditional access sheaths and not with a fans access sheath. So our technology has been so insane in the past couple of years, the technological boom, that robotics seems to be kind of outpaced by that.
What, in your view, is the next exciting frontier then in endourology?
Yeah, so I think we're going to see a huge improvement on suction and aspiration. We have had this huge boom in this in the past 2 years. Everything's changed. What's standard of care now is completely different than what was standard of care even a year ago. And you look at our guidelines, and that's being applicable now. But really, I think we're going to see integration of these systems. So it's still a lot of stuff for us to manage. It's still suction tubing and scopes and lasers and monitors and all this different stuff. And if you look at what's coming out in the future, I think everything's going to be integrated and just simpler.
And what is the most successful quality improvement initiative you have integrated into your own clinical practice, and why?
I would say just having a lot of different tools in my toolbox. So people always ask me, oh, you use this versus this, and which one do you use? And I use everything. And I think having those available, I'm very lucky to be able to do that. I know a lot of surgeons are not as lucky to do that, but just having everything available where I can pick on a case-by-case basis, which technology I'm going to break out, I think has really helped patients, my efficiency, really my surgical efficacy.